All right, so today we're going to talk about stroke and blood pressure. This is stroke month, so it's a good time to talk about this. And it's important to let you know, to review what we know about stroke and how we can prevent it, but most particularly to give you information that you can put in the back of your mind, because if you're ever confronted with someone that has a problem, hopefully you'll be able to identify that it's a stroke and know what to do. That's the biggest thing. I wanted to go over some facts about stroke and blood pressure to give us a good foundation so we know what we're talking about. So for you people that are here, I'm sorry you have to hear this again. 80% of strokes can be prevented. What's good for your heart is good for your brain. That means the activities that you're doing to strengthen your heart and decrease your risk for heart disease are the same things that you're going to be working on to decrease your risk for stroke. High blood pressure is a leading risk factor for stroke. That's why we're going to be talking about blood pressure also. Atrial fibrillation, do any of you know what atrial fibrillation is? Where your heart is beating real fast and sometimes it comes and goes, but the top of your heart is making your heart beat fast. That is a major risk for stroke also, because your heart is not circulating that blood good, and some of it may pool in one area or another, and you're at risk for getting a clot there. It raises your stroke risk. If you have atrial fib, it raises your stroke risk 5 times, so that's significant. Stroke risk is 2 to 4 times higher in smokers than non-smokers. And non-smokers these days count, if you have quit smoking 10 years ago, you are considered a non-smoker, your risk anyway. Exposure to secondhand smoke is a risk factor. Moderate to vigorous physical activity can decrease your risk for stroke by 35%. And if you have a first-degree relative, that means mother, father, brother, or sister who have had a stroke, you're 50 times more likely to have a stroke yourself. 15% of strokes are preceded by what they call a mini stroke. Are you familiar with mini strokes? TIAs. They are something that presents itself with normal stroke symptoms like limpness or unable to move on one side of the body. You know, maybe your face on one side is can't move. It presents the same way, but it's gone in about 5 to 10 minutes usually. That is called a mini stroke. And if you have a mini stroke, you are about 15% of the people at mini strokes will have a major stroke within a year. Okay, strokes in women. More women than men have strokes each year, partly because they, as a gender, live longer. After stroke, women have more disability than men. More women die from stroke than breast cancer, which is an interesting statistic, almost twice as often. A woman's risk for stroke is affected by some things that are particular to women: hormones, pregnancy, childbirth, that kind of stuff. Risk factors such as high blood pressure, migraine with an aura. Migraine with an aura is where you have a migraine and you see lights or there's something out there. That's an aura. Atrial fibrillation, diabetes, depression, and emotional stress are stroke risk factors that tend to be more common in women than men. And then stroke during pregnancy. Pregnancy puts you at slightly higher risk for stroke. Okay, here's a few facts about high blood pressure. 3 in 4 people who have had a first stroke have high blood pressure. 1 in 3 adults over the age of 20 have high blood pressure. That's 1 in 3. That's a lot. Nearly 1 in 6 American adults with high blood pressure don't know they have it. And nearly half the people with high blood pressure do not have it under control. At age 50, you have a 5-year longer life expectancy if you do not have high blood pressure. And if you could get your blood pressure numbers down 10 on the high number or 5 on the lower number, you can cut your risk of death by stroke in half. So that's why we're going to talk about blood pressure along with stroke, because it's such a major factor. Okay, what are the types of stroke? Do you guys know what the different kinds of strokes are? You want to take a guess? Okay, number 1 is called ischemic. That's where a clot blocks the artery. And these clots can come from, they can develop in a weak spot in the vessel, in the brain, or they can come from a different part of the body and block the circulation there. But when it blocks that circulation, then those blood cells that the brain cells that the blood would normally go to suffer for lack of oxygen and sometimes die. That's number 1 kind of stroke, ischemic stroke it's called. The second one is hemorrhagic stroke. And of course, that's where a vessel breaks and it hemorrhages into the brain. And so, of course, the brain cells don't have that circulation. That's a hemorrhagic stroke. The third kind of stroke is a TIA. Do you know what a TIA is? That's a mini stroke, yeah. So that's considered actually a type of stroke. We'll talk about what you should do for each of those. So what are the symptoms of a stroke? Okay, droopy face is one of them, yes. Numbness or unable to move, usually in one side of the body. Okay, yes. What may happen to your speech? Slurred, confused. Sometimes they can't get anything out at all. Okay, so speech is affected. They might be dizzy or unstable, stumbling, that kind of stuff, where they haven't. All these symptoms are sudden, as far as you know. So it's not if someone has a difficulty that's been going on for months, that's probably not a stroke. But if it happens suddenly, then that would be a stroke. Let's see, which other ones we've forgotten. So we've got speech and, hold on one second, let me find my little cheat sheet here. Trouble seeing in one eye or both eyes all of a sudden. That was the other one. And sometimes you'll have a sudden severe headache without a known cause. That is a sign too. Some people have asked me, how do you tell a heart attack from a stroke? So heart attack symptoms, what do you know about them? If someone's having a heart attack, how do they usually act? Yes, pressure on the chest, chest pain. They call it chest pain, but most people actually describe it as a pressure, like an elephant sitting on their chest. So chest pain, sometimes pain radiating down one or both arms up into the neck. Diaphoretic or sweating, shortness of breath, those are heart symptoms. Stroke symptoms are like we've described. So usually they don't have pain with stroke symptoms. They're these, long nerve problems. So I think you can differentiate that. What should you do if you are with someone or you come on someone that has these symptoms? Call 911, definitely. They have an acronym now that you'll find on cards and posters, and it's called FAST. I've seen one on a billboard on the freeway. FAST means check their face, is one side drooping, And if you ask them to smile, it's very evident if they open their mouth because one side is drooping. So face is F. A is arms. So if you have them hold their arms out in front of them, one will drop. Or they won't be able to raise one arm at all. That's the A. S is speech. Is it garbled or not there at all? And T means time. Time is of the essence. Loss of time is loss of brain cells. So the quicker you can get them to the hospital, the better it is. I keep track of several things having to do with stroke patients that come into the hospital because our goals for time, taking care of certain things have to be met. The last time I checked it, almost 3 out of 4 people that came to the hospital came too late. And too late means they were unable to use the clot buster medicine on them. That has to be given within 3 hours, in some cases 4.5 hours, from the time that the symptoms appeared, or they cannot use it. So if they start having symptoms in the morning and they come in at 4 o'clock in the afternoon, that can't be done. So at that stage, you're just treating them and rehab and that kind of stuff to help their disability. So it's so important to come in immediately, to get them to the hospital immediately. And that's where we're hoping that we can spread this information far and wide so that people, there will be somebody there that knows what to do and knows to get them quickly to a hospital. And when you think about it, if you ever are in this situation, it probably will be your family members, your close friends, maybe your coworkers that you're among. So it's really beneficial. You could really be helpful to those you love to know what you need to do in this situation, which is recognize what it is and get them to help quickly. What are the risk factors for stroke? What makes you more likely to have a stroke? Pardon me? High blood pressure is number one. It's the number one risk factor. Then it's not considered high blood pressure. Okay, high blood pressure controlled by medication is good. Okay, high blood pressure is number one. Can you think of anything else that might put you at risk? Age. Age is something you can't control. Along with gender, women are more apt to have them than men, which we talked about. Heredity, if your relatives have had stroke, first degree relatives, they're called, you're more likely to. But race makes a difference too. African Americans as well as Hispanic Americans, they are at higher risk for stroke for some reason. And if you've had a prior stroke. None of those things you can do anything about, but the things you can do something about are high blood pressure, smoking. Smoking puts you at a greater risk. Taking care of your blood sugar if you have diabetes. High cholesterol, there are things we can do for that. Diet, sometimes medication. Physical inactivity and being overweight, we can work on those things. Cardiac disease, having TIAs, atrial fib, certain blood disorders. Excessive alcohol intake also puts you at risk. In fact, they say drinking an average of more than 1 drink per day for women and 2 for men puts you at a risk for stroke. Illegal drug use also, and sleep apnea is another one. So if you have any of those problems and you can take care of them, then it decreases your risk. Otherwise, you're up there quite a bit. Do you have any questions? Do you have any comments? Okay. Okay, so let's talk about blood pressure. High blood pressure. So many people have high blood pressure. What do we do about it? How many of you have high blood pressure? Okay. So what do you do to control that? Medication, sir? Yes, so we can control that with medication. Encourage those around you, if they have high blood pressure, to go see somebody about it. Get it taken care of. Smoking. If you smoke, there are programs that can help you. There are medications sometimes that help you. That's an important thing to get rid of. What smoking does is it narrows down those vessels, so you can imagine those tiny vessels that are in the heart and also in the brain. That's the last thing you want to do, is narrow them down, because they're more apt to have clots. The other thing high blood pressure does that I didn't mention is high blood pressure over a period of time, it injures your vessels. There's all that pressure that, is that creates sometimes some damage there, and so it's much more likely to form a clot at a damaged vessel, damaged part of the vessel, or the damage, if it gets severe enough, sometimes that's when the hemorrhage occurs. So smoking sometimes does the same thing. What kinds of things can we do with our diet that would help us with high blood pressure? Salt is a big one. Decrease the salt. Try not to eat so much salt. If you're a person that loves salt, just try and decrease it a little bit. Some people that have a salt restriction or a sodium restriction are allowed to salt foods as they cook them, but have no salt at the table, no additional salt. Some people have to actually restrict the salt that they use in cooking. But if you could cut back on that, that would be of benefit. And get plenty of potassium. Don't drink too much. And then physical inactivity. We all can do something about that. Exercise, even just being more active, whatever we can do as an improvement would be helpful. The ideal now is to have some kind of aerobic exercise. That's what gets your heart beating a little bit. So walking at a pretty good pace is just as good as anything else. Some aerobic activity for 30 minutes, 4 to 5 times a week is perfect. Anything you can do towards that goal would be really beneficial. Okay. I have some papers. Oh, maybe you got them. This is one that you can keep track of your blood pressure on. Any one time that you take your blood pressure, it's good, but it may not be what your average is. If you go to the doctor and you're extremely nervous about seeing him or talking to him about something, your blood pressure is going to be up a little bit. So I would suggest that you get your blood pressure checked whenever you have the opportunity. Some of the stores have the units in them you could check. Over at the hospital, there's a couple places you could go to have your blood pressure checked on a regular basis, and of course there's no cost to that. Most of the doctor's offices will take your blood pressure if you go in there and just ask for your blood pressure to be checked. Another possibility is getting one of those home blood pressure units. They're very easy to use. You just put them on your arm and push a button, and it takes your blood pressure. So lots of ways that you can keep track of that a little bit. Someone asked me if they're accurate, if those home ones are accurate. They are accurate when you begin, but as they get older, there's no way to tell if they're doing well or if they're not. So in that case, just take your unit with you to someone else and have them check your blood pressure, compare them. I don't think that there's any way you can send it back and get it calibrated or anything, but they are good to use. So I would suggest you do that. This sheet, the consequences of high blood pressure, kind of tell you different things that can happen besides stroke. That's the one up in the head, but also you can lose your vision if you don't take care of high blood pressure. Little hemorrhages in the eye you can lose your vision, and I know of a lady this happened to personally. She decided that she didn't want to take her blood pressure medication and just went off of it, and she eventually was blind, which is so sad. Heart failure, we've talked about the connection there, or a heart attack. Kidney disease or failure can be caused by high blood pressure. It just injures those tiny vessels that are filtering all that fluid through the kidneys. And sexual dysfunction also can be a cause of can be caused by high blood pressure. This is a sheet that reminds you of this acronym FAST, and it actually says there is a mobile app that can remind you. It's called FAST mobile app. I didn't know that, but you can get information on there. I wanted to talk just a minute about what is considered high blood pressure. This group of, this bit of information was put together by the Stroke Association and the Heart Association. And if you notice, if you have one of these sheets, you will notice that anything above 120/80 is considered elevated blood pressure, and then it gets worse. 140 or higher on the top is considered stage 2 high blood pressure, and then over 180 is a crisis that you should check with your doctor immediately. So this has changed. This is in contrast to the physicians' associations that are not, they are not this low. So if you check with your doctor, he may be fine with you with a blood pressure in the 130s, and maybe up to in the 140s. I don't know, but they are a little more lenient. So this is kind of interesting. The trend, just like it is with blood sugar, is getting down to a better, a lower reading. I have the same problem with the Diabetic Association, or the endocrinologists versus the medical doctors. The endocrinologists want blood sugar down a lot lower than they do. So, but anyway, just so you're familiar with that. And then you have a sheet on lifestyle changes to prevent stroke. So how can you change your eating habits? How can you stop smoking? How can you do some physical activity? That's helpful too. And I think you have all the rest of it. Do you have any questions? Yeah. Yes, migraines with auras put you at a higher risk for stroke. So if you have migraines that, have the lights or the whatever, have that is a risk factor. I'm not sure why. Anything else? Oh, well, it's nice to talk to you. Thank you for coming. And I brought my blood pressure cuffs. If any of you would like me to check your blood pressure, I'd be happy to. Marianne, is there anything else you think I should cover? Okay, well, thank you for coming, and good luck. And if you see someone with a stroke, you get them right there to the hospital. Thanks.
Thank you.
You're